Australian teams are on their way to Vanuatu to assist with the rescue and recovery effort after two earthquakes and plenty of aftershocks rocked the capital, Port Vila. The death toll has risen to 14, with concerns more people could still be trapped under collapsed buildings. The first Australian relief flight has taken off from Queensland with supplies and specialists on board. There are reports that water supplies in some parts of Vanuatu are limited and internet and power connectivity remains poor. Well, Dr. Basil Leodoro is a health emergency response director at Respond Global in Vanuatu. I spoke with him while he was on board the Helper 1 vessel heading towards Port Vila. He says residents in Vanuatu remain anxious in the wake of a second earthquake that struck early this morning.
Well, we were sailing between islands as we are right now, and we didn't feel the second one, but we did get the marine alerts about it. We understand from our team that's responding in Port Vila right now that they did feel the second one, and there was a lot of panic and anxious people wondering whether the building was going to hold up or not, where they were sitting in. So a lot of stress in the communities in Port Vila at the moment, as you can imagine.
And of course, sadly, we know that at least 14 people have died. But is Vanuatu bracing for a much bigger toll?
We're expecting the numbers to rise. We haven't been able to really fathom the damage that has been done around the city, but also around Efate Island. On board Helper 1, the Respond Global and Shefa provincial teams have been able to rapidly assess and look for any casualties in 11 islands, in 8 islands so far. And we have a couple more to visit tomorrow, but we will be continuing that work throughout tomorrow before joining the team in Port Vila.
And what have you observed in those 8 islands that you've been to so far?
So we've been able to check for casualties related to the earthquake. We've been checking for infrastructure damage to essential buildings. We've been looking at how access roads and access to the beach landings might be affected. And also we've been interested in the gardens and if any of those have been damaged, the normal livelihood of the people. And what we found is in the islands that we've visited so far on Epi, Tongoa Island, Tongariki, Puninga, Emai, Makira, and Mataso, we haven't found any casualties, thank God. But there's been landslides that have, in some islands, affected the beach landing and affected the roads. And in other islands, the landslides have affected their gardens, like on Mataso Island. And being an isolated island, we're very worried that they may run short of food very shortly in the coming days. We've also found some of the water storage areas, water storage wells and underwater wells have cracked. And so there is a risk of waterborne diseases. And we are reporting on these back to the National Disaster Management Office and to the National Health EOC and the Provincial Health EOC as well, so that we can address these and keep an eye on any public health diseases.
Yes, now we do have reports as well that many people may still be trapped under the rubble of buildings and other properties that have collapsed. How are efforts going on to reach them?
Well, that's unfortunately the current situation. Our response teams, the Vanuatu Mobile Force, Vanuatu Police Force, Pro Medical, Pro Rescue, as well as other first responders, I believe are being joined by some overseas urban search and rescue team. The effort will continue in the next couple of days. It's been very difficult because of the power cut, and so they're unable to use a lot of the power tools, having to resort to generators. The access roads into Port Vila City have also been affected, and so have also been cut. And so we're unable to move heavy-duty vehicles to be able to do the heavy lifting for these rescuers. And so reports are still there that we have unaccounted people who last reported being in those buildings that have collapsed.
And have these search and rescue efforts been made more challenging because of aftershocks?
Absolutely. Not only that, we with the power cut, we're also very aware that the return of power to some of these areas, if we're not careful, puts the rescuers at risk. And so every effort is being made to be safe. But unfortunately, it's now going into the second day of the response, and we still have a lot of work to do.
Dr. Leodoro, what does Vanuatu require now immediately to help with search and rescue?
Well, the Prime Minister has declared a state of emergency, and the government is opening up the pathways and the partnerships that we have relied on with Australia, New Zealand, with France, to open up the pathways to be able to get rescue teams to come in. I believe that urban search and rescue teams from Australia are making their way, if not have arrived in Port Vila to assist. We also need the support, surge support for our hospital services as we tackle the growing number of casualties who turn up, and also looking at the normal everyday emergencies and services that we need to maintain while this major incident and crisis unfolds. So the water has now been reestablished and power to some areas in Port Vila, as reported by our teams, but we will be keeping a very close eye on the public health and disease outbreak side of things, and we will be supporting the national government response through NDMO and through the National Health EOC.
And of course, Vanuatu is no stranger to major natural disasters like cyclones and earthquakes in this case, and it is a resilient nation. But how does Vanuatu get on recovering from such a powerful incident, this double earthquake?
That's right, Girish. So we are very resilient people. You'll always find a smile no matter what, but this is certainly a tough blow, caught everybody off by surprise. And in order to overcome this, I think we're going to rely heavily on our partnerships and our donors to be able to support us to recover. The recovery effort will likely take years as we need to do the debris clearance. We will need to rehabilitate the casualties as they recover from their injuries. And so it's going to take us years. And of course, the mental and psychosocial health of and well-being of our communities will also be considered in all of this, and is something that we need to manage.
Okay, Dr. Basil Leodoro, we really wish you well in the work that you are doing, and thank you so much for speaking with us.
Thank you so much, Girish. It's been a pleasure.